Jeff Davis, MD, is board certified by the American Board of Family Medicine. He is an advanced fellow in regenerative and functional medicine through the American Academy of Anti-Aging Medicine. Dr. Davis completed his residency in family medicine through the University of Kansas at Via Christi Hospital in Wichita, Kansas, and earned his medical degree from the University of Texas Medical Branch at Galveston. He also holds a Bachelor of Arts and a Master's of Clinical Gerontology from Baylor University. Dr. Davis owns and operates Prairie Health and Wellness in Wichita, Kansas. He has worked as a surgeon, internist, and as an FDA investigator. Dr. Davis is the formulator of PhyzixMD and is married with 4 children. Now here is Dr. Jeffrey Davis.
Hi, I'm Dr. Jeff Davis, a board-certified family doctor and founder of Prairie Health and Wellness. I've been working with Bonvera to develop PhyzixMD, an exclusive, high-quality line of nutraceuticals to specifically address some of the common problems that people suffer from. We've chosen a U.S. manufacturer who validates each ingredient for quality and purity before putting anything in the bottle. Now, these are all products that I use on a daily basis in my own integrative medical practice in the heartland of America. The product that I want to talk about with you tonight is called Just for Her. Now, Just for Her is a comprehensive blend of vitamins, minerals, and botanical extracts that are designed to support female hormone levels, healthy female hormone levels. Now, this can be used for both women who are still menstruating or those who've gone through menopause or in the process of going through menopause. And imbalances in hormones are a very common thing that we see in our practice, and this can be responsible for a lot of the physical discomfort and mood changes that are associated with PMS, like cramping, breast tenderness, water retention, even mild depression. These imbalances can also be manifest in women who are premenopausal or perimenopausal in the form of hot flashes, night sweats, vaginal dryness. So these are very common problems that we see in our female population in our practice, and Just for Her has an excellent blend of botanicals and micronutrients to help address these. So let's talk a little bit about the ingredients. Just for Her contains chaste vitex, which is chaste tree extract, and black cohosh. Now, these 2 herbs are very important, and they're recognized for their effect on helping to balance female hormones. Also includes calcium D-glucarate. Now, calcium D-glucarate's a very unique form of calcium, and I want to make a special point here to say that this is not the same calcium that you get in a CalMag supplement. In fact, if you've heard me talk before, you know that I'm not a big fan of taking extra calcium. I think we get enough calcium in our diet in most cases, and I think that most of the problem that we're having with calcium, we're seeing overcalcification of tissue, in the form of microcalcification in breast tissue. We're also seeing calcification of aortas. So it's making our vessels stiffer. So this is a different type of calcium, and so think of it more of as a D-glucarate. So calcium D-glucarate is going to help support the liver's role in detoxifying and eliminating excess estrogen. Now, detoxification and elimination are 2 things that we could probably spend hours talking on, but I'll just briefly kind of go over what happens and how the human body creates hormones. So the first thing that happens is we start with a substrate, and the substrate for all the steroidogenic hormones is cholesterol. Now, cholesterol goes through several different steps as our body synthesizes the various hormones that we need, and each of those steps, an enzyme is involved, and then after the product, our body makes that product, we have to have enzymes that help break the product back down. Okay, so that's the detoxification and elimination pathway. So the reason we've chosen the ingredients that we have is there's a lot of us have genetic variation that changes some of these enzyme steps, and maybe they don't work as well as they would in somebody who didn't have the genetic variation. The most common one that we deal with in our practice is MTHFR. That stands for methyl tetrahydrofolate reductase. And methyl tetrahydrofolate reductase is one of the things that helps us convert folic acid into folate. If you're taking a supplement that has folic acid in it, your body's going to have to methylate that to the folate form so that you can actually utilize it inside your cells. So that's one reason in this Just for Her product, we've actually chosen to use the methylated forms just right from the outset. It's immediately bioavailable to the body. So calcium D-glucarate is going to help with the liver's role in detoxifying and eliminating the estrogen. The next one we need to talk about is diindolylmethane. Diindolylmethane, or DIM, D-I-M, is an active metabolite of indole-3 carbinol. And indole-3 carbinols are found in the cruciferous vegetables. And in fact, in addition to DIM, we also have broccoli seed extract in here. And broccoli seed has some of the highest concentration of the indole-3 carbinols of any of the cruciferous vegetables. So DIM and the broccoli seed extract are also included, and these help maintain safe estrogen levels. We also included a synergistic blend of antioxidants. And these antioxidants are turmeric, which is a powerful antioxidant that comes from India, rosemary, resveratrol, which comes from red wine, and then green tea. This synergistic blend demonstrates how powerful these antioxidants can work together and actually have an anti-inflammatory effect. Now, those can help support the body's natural defense against oxidative damage and also play a role in reducing the cramping that sometimes associates PMS. Oxidation is part of life. When we come in contact with certain substances or we have stress in our lives, we create oxidative free radicals, and those free radicals need to be balanced by antioxidants. You can find antioxidants in berries, in green leafy vegetables, and so those are included in the Just for Her product, specifically for the ability to help with the excess oxidation that sometimes accompanies hormone imbalances. You know, again, the vitamins that you're going to see on here, when you look at the label, it's going to be the methylated form of these vitamins, and really we're choosing those because they are the most bioavailable. And bioavailability, to me, is very, very important. If I'm using this clinically in my practice, I want to make sure that this product is going to do what I know the science says that it does. And in order for us to do that, we have to have them in very, very specific forms. Helps with absorption and make sure that your body can effectively assimilate and use these things. So because this product helps with proper metabolization and excretion of hormones, we will frequently recommend it in 3 specific settings. The first setting is in someone who has PMS, so premenstrual syndrome. And probably the most common thing that I hear from women who've used this for a couple months is that they feel like their period just kind of sneaks up on them, whereas in the past, they would know a week to 14 days before their period started, they would start getting moody and bloated and have breast tenderness and just generally not be feeling well. And then their period would come, and then they would have a few weeks of feeling better, and then the cycle would start all over again. So in the women who are using the Just for Her product, after about 2 months, they'll say, you know, I just don't feel those signals of, hey, I'm about to start my period, meaning all the negative signals that they were having before. So that's probably the one important way to use it is in a woman who's experiencing a lot of problems with PMS. PMS, most often, if you measure a woman on cycle day 21 who's having PMS, one of the things that we frequently find is that she has a very, very low progesterone. And it used to be in my practice, before I had this product, I would just start women on extra progesterone during that time. But progesterone can make people sleepy. It can cause breast swelling. So, I mean, sometimes there's some side effects of using that. But that's what's been nice about the Just for Her product is that for a lot of those women who I would have used progesterone before, we're actually able to correct it with just the simple micronutrient, taking it twice a day. So that PMS, very important use of the Just for Her product. The second most common use for the Just for Her product is in women who are having difficulty with fertility. And you know what's interesting is that those women are having irregular periods, or maybe they're not ovulating every month. It's difficult for them to get pregnant, and this product definitely has helped a lot of our female patients with that. In fact, some of our older female patients who thought they once couldn't get pregnant, we would warn them that they need to use some form of contraception when they start on the Just for Her product, because it can actually make it so even women who've never been pregnant before are getting pregnant, and that's happened more than once in our practice. So if you're using the Just for Her product and maybe you've think you're kind of past the childbearing ages, but that you've never gotten pregnant before, it's important to think about the fact that this could balance hormones effectively enough that you might be fertile again. So the third way we use this hormone is in our postmenopausal and perimenopausal women. A lot of those women are on hormone replacement. We use quite a bit of bioidentical hormones in our practice, and Bioidentical hormones are hormones that are synthesized specifically to be exactly like the hormones that are naturally present in the human body. In fact, once these hormones get into a woman's body, there's no way to distinguish them from the hormones that her body normally would have made. So this Just for Her product in helping to balance those things is essential for women who are on hormone therapy of any kind, really, because they need to be able to effectively metabolize those hormones that they're on. And in some cases, they can actually, they may require even lower doses of hormones while they're going through the hormone replacement. So in using these, it doesn't disrupt the function of the bioidentical hormones. It really helps to ensure the body is using them efficiently, and it's going to help support that liver's ability to detoxify the specific pathway for that hormone. We also tell people if you're using it to help get pregnant, it's very important to understand that once you get pregnant, you need to stop Just for Her. The herbals and for most women, and the prenatal is about the only thing that we recommend pregnant women be on. So this is one of those products that, because of the herbals in there, they're not well studied and understood in pregnancy. It would probably be best that once you get pregnant, you stop this for the 9 or 10 months that you're pregnant. So again, I just want to emphasize the three most common areas where we're using this product are in our PMS patients, young patients. We're using it in the perimenopausal patient, and we're also using it in women who are having difficulty with hot flashes, night sweats, vaginal dryness, so the postmenopausal women. So along with a healthy lifestyle, because supplements are just that, they're to supplement the things that we're already doing for our body that are good. Along with a healthy lifestyle, I think the Just for Her product can be useful for many of the people that are suffering from these common problems. Thank you for listening, and we look forward to seeing you at our next big event where we'll talk more in detail about Just for Her, and we're very excited to be able to launch this exclusive product with Bonvera. Thanks.
We hope you've enjoyed this content. Take the next step and attend a live EXO event. While these techniques and approaches have worked for others, no one can guarantee they will work for you. We hope, however, they will assist you in building a strong and profitable business. This is a copyrighted program. The purchase of these materials is optional and subject to the refund policy on the exotrainingsystem.com website.